Good morning. I am Stephanie, and I'm going to report or to discuss about the lifespan approach and least restrictive environment for learners with visual impairment. Okay. To start with, after all the comprehensive assessment after the birth of the child, it is now important to have that what we so-called learning development to be able to attain the holistic development of the child with visual impairment. And we have those programs for the child to have that what we so-called again holistic development as he or she grows. So what are those programs pertaining and considering the lifespan approach of the child? We have now the infancy from 0 to 2 years old, and the program for this age is the early intervention program. When we say early intervention program, it is services are similar to school age special education services, but are for children ages birth to 2 years old. Early intervention is a system of services and support designed to help families care for and encourage the development of their infants and toddlers from birth to 36 months of age with disabilities. So upon on this, when we say program, should be systematic and should be documented and planned as well. And in terms of that, we have what we so call this document, which is the individualized family services plan. Individualized family services plan, or IFSP, generally includes a great deal of input from parents as to what they see as with their specific strength, as with the child's specific strength and challenges, and also including the observations of the doctors and the therapists. The IFSP, the IFSP, the IFSP layout when and where services will be provided and what goals those services will help the child reach. Services usually include speech therapy, physical therapy, and sometimes occupational therapy, in addition to therapy, particular with learners with disabilities, and services helpful to the whole family. Family is the main focus of this. Okay. Family is the main focus of this program, and it is the main goal is that to empower the family in terms of the condition and on how they are going to handle their child, and who are the case manager as at the same time implementors or developing team of this program. We have the social workers, pediatrician, ophthalmologist, orientation and mobility specialist, low vision specialist, and the families. And when it comes to the low vision and orientation and mobility specialist here in Philippines, we have the teachers of learners with visual impairment usually do the duties of these people. Okay, what are those services related on this program, on this particular program, I should say, which are those assessment containing functional vision evaluation, learning media assessment. At the same, another thing is we have the planning on the development of IFSP, and we have the audiological services. We have the vision services, including orientation and mobility, and occupational and physical therapy if necessary, speech and language therapy, special instruction services, medical and nursing services, psychological and social work services, health services, family trainings, counseling, and home visitation. Okay, these are the programs of the under the, or these are the services under the early intervention program. And another thing, we have the national programs for the we have the national programs to what we so called to have that to prevent the blindness as much as possible. So we have first the first 1,000 days of life, or otherwise known as the Kalusugan at Nutrition ng Magnanay Act, wherein the mother is obliged to breastfeed her child from 0 to 24 years old, 24 months, I should say. And it is strictly implemented to the different public hospitals here. And we have now the guidelines for the implementation of the National Prevention of Blindness, prevalence of avoidable blindness in the Philippines through the provision of quality eye care and identify children with visual impairment in the community for timely intervention. So the Department of Health the Department of Health is sending different specialists to different LGUs to have this medical mission, or what we so-called eye care mission. And what are the focus? What are the focus of this program in terms of the learning development of the child? We have the providing a variety of experiences, provide actually interesting toys and materials, reducing auditory distraction, talk to the child, and one of the most important is that encourage the child who is visually impaired or blind to move. Okay, that is the focus. And after all, if the child now can go to another stage of learning and another stage of, or another age, which is the toddler. So toddler age is 3 to 4 years old, which is it is the transition from IFSP to IEP, or from individualized family services plan to individualized educational plan. When we say individualized educational plan, it is now already on the formal school, or the transition now of the child is from home to school, because the IFSP, or the individualized family plan, or the early intervention, is usually home based, or another places depending on the recommendation of the IFSP team. Now in this stage, the IFSP team must make the comprehensive decisions about whether this is exclusive home instruction, or either blend of home teaching and center-based teaching. So either from home or home-based, or on the preschool setting, preschool classroom. In this stage, childhood educators may encounter both IFSP and IEP when serving young children within educational setting. IFSP will be particularly prevalent at meetings where children are transitioning from early intervention to preschool setting. So at this time, the early educator meet the two plan, which is the IFSP and the IEP, because of the transitioning happens. So who are the case manager? And case managers and implementers at this juncture, or at this age of the child. So we have the pediatrician, the ophthalmologist, SPED teacher, early childhood educators, orientation and mobility specialist, low vision specialist, and the family. Okay, and what are those related programs or related services during this age of the child? We have the if the child is now recommended to have that SPED program and related services. And another thing, if the child can now promote to general education program under preschool setting. And what are the focus of the IEP, or the developing or the plan of what are the focus of the IEP in terms of learning and learning development? We have the select and use and utilize appropriate magnification when needed, focus on language skills, self-care skills, daily living skills, interpersonal and social skills, stimulation of all senses, growth and fine motor activities, encouragement of independence and responsibility, and last, establishing of concepts. As these skills above mentioned is already we're introducing now the ECC, or the expanded core curriculum, from the basic skills or areas of development as mentioned. So as we go on with the stages of life, we can now meet, we can still meet now the ECC, or the expanded core curriculum for learners with visual impairment. The next stage for the learning development of the child is that the preschool, ages 4 to 6 years old. It is still IEP based, and the focus of this is incidental skills that are learned is impacted by vision loss that would really affect the educational or academic performance of the child, and it is more on unique needs and prerequisite skills that the child should have to develop. And in terms of that, we have now the expanded core curriculum. Okay, the expanded core curriculum, or the ECC, is a curriculum that addresses functional outcomes for students with visual impairment, and including 9 areas. And what are those 9 areas? We have the compensatory skills, social interaction skills, recreational and leisure skills, orientation and mobility skills, independent living skills, assistive technology, career education, sensory skills, and self-determination. So these are the primary skills that the child should have to develop as they go on and as they grow. Then, upon on this, it is prerequisite. It is prerequisite skills. It is organized, and it is systematic, of course. And upon on this, we have now the newly developed here in the Philippines. For introduction only, we have the newly developed curriculum developed last 2020. So it is the it is the ACC, which is provide supplementary skills that will equip the learners to be more competent and to cope with the demands of K-12 curriculum. It means that it is aligned on ACC, or in expanded curriculum. However, the content is based on the K-12 curriculum. It allows them to perform and participate in inclusive setting with their sighted peers. In determining the criteria of the selection of this ACC, the Department of Consultation and stakeholders considered only essential skills that the child should have to develop, because other skills are already coincided or covered to the different subjects and different learning areas in general education. But these 4 essential areas are significantly essential for the development of the learning development of the child in terms of academics. So what are those? We have the Filipino Braille Code, Unified English Braille Code, the use of grammar abacus, and the orientation and mobility. And to be able to ensure the efficacy of this curriculum, the learning competency of the child, okay, okay. The learning competency is, the learning competencies are written from simple to complex to be able to prioritize the next level of skills. Then the duration of the lesson is based on the capacity of the learners and how the teacher demonstrate and teach the skills, which is important to their development, to their learning development. And the curriculum is written into key stage format, which is considering the lifespan approach, which is from kinder, grade 1 to grade 3, grade 4 to grade 6, grade 7 to grade 10. The learning competencies, goals, and objectives are written depending on the level of age, depending on the age, level, and skills of that child. Okay, another thing is that to be able to the main goal of the ACC likewise the ECC is to bridge the gap from disability to cope with the general education program as a whole. Okay, and the case managers or implementers of this particular age or plan in this particular age, we have the SPED teacher or what we so called we are the teachers of students with visual impairment or the TVI, and we have the orientation and mobility specialist, early childhood educator or kindergarten educator and administrators, and medical specialist or therapist if needed. And the more important is the family. Another stage we go now to school age, which is ages 6 to 11 years old. The transition now, it is on a grade to grade transition, still based on IEP recommendation and promotion of general education curriculum. And the services and program pertaining to this age of the child is that the SPED program, wherein is to provide the instruction and support necessary to allow the student to reach his or her academic and functional potential, wherein she can now receive those prerequisite skills that might help him or her to be more productive or competent in terms of general education. And what are these? So the child now is in this key stage, in this school age, the child is expected to can now read and write Braille, Filipino Braille Code, and Unified English Braille Code, uncontracted and contracted. So when we say uncontracted, it is the child can now read uncontracted from grade 1 to grade 3 and grade 4 to grade 6 for contracted. And we have the child is expected to write and read basic NMF code and can perform at least 4 fundamentals operations using abacus. And we have the orientation and mobility. And another thing is that training on assistive devices. Okay. In this level, it is now important to have that ongoing assessment in terms of functional vision assessment, learning media assessment, and the assistive technology. So as they started to learn, as they started to have the transition from grade 3 to grade 4, so little by little the teacher can now introduce the assistive technology to be able to help them to cope with the general education curriculum as well. Okay, and another thing is, aside from SPED program, is the general education program. If the IEP recommended and the general education, and based on the promotion of general education curriculum. Okay, and after that, we have now the secondary stage from ages 11 to 14 years old. And we have the transition from elementary to secondary. Still IEP based, prerequisite skills mentioned on ECC or ICC. ECC, or here we have the ACC. And we have the basic, we have the general education curriculum or general education program promotion based on academic performance and social participation. And who are those members, or let's say who are those case managers and implementers of this in this area or in this stage? We have the SPED teachers, general education teachers, rehabilitation counselor, and career coaches if necessary now, adult with visual impairment as a role model, and the family. The focus of the the focus now of the program or the plan on the IEP and the IEP specifically is that it is more on refinement of academic and personal skills, learning to acquire, evaluate, and organize information, selecting, using, and maintaining equipment and tools, including technology, setting personal and vocational goals, analyzing and solving problems at school, home, and community, developing personal and behavioral values such as honesty about the visual condition related to peer pressure. So these are the focus of the IEP. And in terms of services or programs related on the age of the child, still we have the SPED program wherein the prerequisite skills should be taught as well, coincided with the ACC or ECC, which is cover on recreational leisure skills, career orientation, career education, and the self-determination, because it is more on interest exploration at this particular age. And another thing is that the training on equipment, tools, and technology, and orientation and mobility, travel independently using cane, and navigating different accessible application or different accessible GPS to be able to travel independently from community to another community using through public transportations. Then another one is that we have the ongoing assessment on learning media assessment, assistive technology, and on orientation, assistive technology and functional vision evaluation if still suggested or recommended. Next stage is that the secondary to post-secondary, ages 14 to 17, age of minority. So at this point, it is still IEP-based transition from school to community. Okay. The focus of the transition plan as part of the transition plan and as part of developing Self-determination encourage the students to this following. These are the following. Set goals for the future, develop a plan to achieve their goals, make choices about everyday activities, know their rights and responsibilities, understanding their strengths, likes and dislikes, understanding their accommodations. So, yan. In terms of transition, transition services are coordinated set of outcomes-oriented activities for a student to promote the movement or transition from school to post-school activities. The coordinated set of activities is based on a student's need, preferences, and abilities, and may include instruction and related in services, community experiences, development of employment, post-school adult living objectives, daily living skills, instructions, and another one is the functional vocational evaluation. So that is the concentration of the transition plan in terms of different services. It's still on more on community based or employment based. So another transition we have now, another transition is coincided with this is that transitioning to college or from secondary to tertiary. For some transition age, students obtaining college degree is necessary step towards reaching the employment goal. In this situation, the team will guide students' choice of where to attend college. So it is still based on the cognitive capacity of the child and at the same time, the recommendation of the IEP team. So it is it is more on college preparation, on how to deal with professors, familiarization on social facilities, trainings on current and trends, assistive devices for academic survival and even in daily living. Another transition now in terms of age or in terms of learning development of the child is that we have now the transition to adulthood ages from 18 to ages 18 years old and beyond. So what is the focus of the transition plan of the IEP? It is on the content is college preparation, career orientation or exploration, and critical survival skills. So what are the trainings or services coincided here? We have the blindness skills development, which is under of this is independent living skills, effective communication, and safety travel. Another one, we have the computer access technology, career development, employability skills, and the college preparation. Okay, the ideal goal is for maximum growth of each individual according to their physical abilities and cognitive development. So the focus is not just only in cognitive development, also in physical abilities. So, and it is about it is community based, employability based, and um, um, cognitive based in terms of the child is qualified or recommended for a college degree or college education. It is more on being independent as well. So who are the case managers in terms of this development of the child? We have the family, educational staffs, other organizations such as private and public centers with offering vocational and rehabilitation trainings. in terms of the different skills of the child that they can enhance, develop, and in terms of their interest. And we have the rehabilitation counselor or career coaches. Okay. Another thing, we have now the least restrictive environment for learners with visual impairment. So we have first the learning environment classroom set up differentiation principle. So what are those? We have the we have the general or regular education classroom wherein the child can receive the education instruction using the general education curriculum and dealing with different tasks, performance tasks, academic tasks, and enjoying the social participation and competing with his or her sighted peers or sighted classmates. It is more on academic tasks and social participation in terms of general education classroom. And another one is resource room. Some schools, districts cluster all of their children within visual impairment into one resource room within spread center in elementary school and secondary school. So it is the place wherein the child can receive the instruction, the special instruction, prerequisite skills pertaining to his or her braille, abacus, or orientation and mobility, and another thing, and another services as needed. So another one is we have the self-contained classroom, wherein for students with visual impairment, some schools provide a separate classroom for children with visual impairment that will be taught by teacher of students with VI. Or even can be one by one instruction or individualized instruction, which is tailored to the needs of the child or ability of the child, and depending on the recommendation as well. And another one is that, okay, it is case-to-case basis. Another one is that the residential or specialized school, or referred to as the school for the blind. These state schools, okay, these state schools have in many cases also become learning center that provide special assessments or instruction, consultations, and other services to school across the state or cities. Okay. Another one. Okay. These are the learning environment of our learners with visual impairment. Another one to consider is that learning environment, least restrictive environment in terms of based on program of on IEP recommended, or based on the, let's say, placement options. So we have the mainstreaming, integration, and the inclusion. So when we say mainstreaming, it refers to placement of a student with disabilities into ongoing activities of regular classrooms so that the child receives education with non-disabled peers, even if staff must provide supplementary resource services. So wherein the child can receive the instruction most of the time, full Mondays to Fridays, with his through his general education instruction or general education teacher, and enjoying the opportunities, academic academic tasks, performance tasks with his or her sighted peers. And we have the integration include mainstreaming into regular classes and access that inclusion and participation in the activities of the total school environment. It means that the integration combines placement in public schools with ongoing structured and non-structured opportunities to interact with non-disabled age appropriate peers. So it is focused on more on social participation, either the general education, either the general education instruction or general education instruction is not prioritized or considered. But the focus is more on social participation, and the child have that opportunity to enjoy and to attend the different services, different programs, co-curricular activities inside the campus or inside the classroom. So another one is we have the inclusion. Inclusion refers to the total integration of a student with disability into regular education program with special support. In inclusion, the student's primary placement is in the regular education class. However, if the child has another services that if the child can attend other related services in terms of another condition of the child, the general education teacher can allow the child to attend. So the child is not required to attend 100% of the class, but the focus of it is still on regular education class. But if there is any related or if there is any related or in need session for related services, the general education teacher will allow it. Okay, so question, are these programs appropriate for learners with visual impairment? And the answer is yes or no. It is case-to-case basis, and it is based on the recommendation of the IEP team and the individualized educational plan as a whole.